Hi, this is Hyperbaric Tim from HBOT Boston. It is March, and that means it's Brain Injury and Concussion Awareness Month. This initiative aims to raise awareness about the causes and consequences of brain injuries, what are often called a silent epidemic. Today I'm going to cover information about hyperbaric for brain injury and concussions. We're going to cover signs and symptoms, what to look for, what a protocol might look like, and the mechanism of action that can cause brain injury or concussion. Concussions are often mis- or underdiagnosed. If you are mis- or underdiagnosed for a brain injury or a concussion and don't get the proper care, you can develop what's called post-concussion syndrome. Post-concussion syndrome symptoms can include brain fog, anger, sleep issues, dizziness, headaches, sensitivity to light, anxiety, fatigue, ringing in the ears, vision changes, or you can't read as much without getting a headache or tired very quickly. All of these are symptoms of post-concussion syndrome that should be monitored very closely. The mechanisms of action for a head injury or concussion can come from a lot of different things. Motor vehicle accidents, whiplash, blast injury, a slip and fall, sound waves, or anything that rocks your brain. If you don't need to be knocked out or hit your head to have a concussion. That is a big misunderstanding with concussions and post-concussion syndrome. Not every concussion is the same, so we have to treat everybody who has experienced a concussion or a brain injury differently. We first have to get blood to the brain as soon as possible when a concussion or a head injury is diagnosed, because lots of blood and oxygen are needed in the brain for the brain to function. We need blood flow there because we need to clean out the bruising and calm down the inflammation. This is where hyperbaric oxygen therapy comes in for head injuries and concussions. Hyperbaric will decrease the amount of inflammation and improve symptoms that you have after a head injury or concussion. For hyperbaric to be as effective as it can be after a concussion or a head injury, we need to start sessions as soon as possible. This may look like 4 days a week if you are more in the acute phase, or 2 days a week if you are more in the chronic phase. In some cases, I will have people do 2 times a day, 4 hours in between each session for 90-minute sessions. If you or anyone you know has experienced any of these symptoms or mechanisms of action, reach out to me at hbotboston.com to schedule your consultation or HBOT sessions.